is Dr. Ivan del Portillo Pacheco. I'm a specialist in minimally invasive aesthetic medicine and regenerative medicine. We treat a lot of variety of problems. Stem cells have two primary ways of working, which is immunomodulation and differentiation. The most advertised way is differentiation, the creation of different types of tissue from mesenchymal stem cells, or MSCs. You can create different types of tissue as long as they're from the same lineage of the mesenchymal stem cells. This can be connective tissue, cartilage, tendon, muscles, vascular cells, some type of connective tissue. The primary function of PRP is just the stimulation of cell repair on a specific area. In all of our patients, we combine the PRP therapy with the stem cells. But by having the PRP combined with it, we have a quick relief because of the growth factors of the platelets. For joints, the most commonly thing that you have is a little bit of inflammation after the procedure, not because of the stem cells per se, but because of the syringe that you inject. So the needle creates to some degree an inflammatory process, and stem cells get drawn to inflammatory process to help heal out the area. They have outer membrane receptors that get drawn to inflammatory mediators, and that's how most of the function process happens. That is one of the things that we tell patients: try to avoid non-steroidal anti-inflammatory medication and steroid anti-inflammatory medication at least 1 week prior to the therapy and 2 weeks after the therapy. This is not because it's going to affect the stem cells, but because it's used so that we can promote the effect of the stem cell healing. Normally, for the stem cell to work alone, you need about 3 to 4 months. All the cells in the body have to go through a maturity process. In order for the MSC to create cartilage, etc., it has to go through a maturity process that takes about 3 to 4 months. You can have physical therapy after stem cell therapy. The only thing, if we're going to inject, for instance, a joint, is not to use that joint for the first 24 to 72 hours. Afterwards, all the activities should be normal, but if you have, or you're going to start to do exercise with that joint specifically, you need to start off like if you were a newbie, okay? Low weight exercises, and then you continue as you can tolerate. If there's pain, you should stop the activity and go back one tire of weight. Patients that have osteoarthrosis 1, 2, and 3 are normally typically good patients for stem cell therapy. When then you have osteoarthrosis grade 4, for the most part, you're going to need a knee replacement. It's very hard to see a complete case 4, right, of osteoarthrosis, because when there's bone-to-bone friction all of the time, then you start to create also osteoblasts and you start to form deformity because the bone heals in a different way as other tissues. In some patients, it can last for all of life, right? It depends a lot on how much damage they have because you need to repair cartilage, bone, tendon, muscle that you have in a specific area. So as long as you don't create a new injury, then it can last for a longer time. For the most part, the one that I do more frequently is joints. We have seen also a lot of disc bulging. Bulging discs and problems like that should be approached with an epidural procedure, in which case we bring in an anesthesiologist and he's the one that injects it. That lowers the swelling and can repair some of the discs. That can be done as long as the disc bulging is being from the T12 lower. In some patients, we can do also cervical applications. For those applications, we do what is called paraspinal application. The paraspinal application is when you inject in the bones aside, in the muscles aside to the spinal cord. You can also use it in aesthetics. The growth factors of the stem cells can help out rechange the skin, take away some type of wrinkles as long as they're small wrinkles. And you can also inject it in deeper layers for the creation of collagen. All the results, the patients is the answer for that. I'm an aesthetic and a regenerative doctor. The objective of the clinic, or one of the values of my clinic, has to be to help the patient in all cases, right? And we would advocate, if the patient cannot afford it with stem cells, we'll do PRP, or we will adjust anything that we need for the therapy to take place for the patient.